You guys can see the screen, right?
Yes.
The husband is so angry regarding his wife's situation, and he wants to meet you. Or your consultant did assign you to talk to the gentleman, being the senior house officer in the neurology department as regards the clinical situation, the management plan, and to address any concerns he may have. Assume that he is the lasting power of attorney. Sorry, that he is the next of kin. Or assume that he has permission. Let's do this. Permission from his wife to discuss. So, Dr. Gamal, did you get the scenario?
Yes, I've got it.
Kind enough to share that, it'd be great. So, to recap this, we have a 60 years of age lady who was been admitted 2 days ago with altered state of mind. Her past history has revealed that she has metastatic breast cancer with mets to the brain, bone, and the liver, for which she was on palliative treatment. On visiting here today, the husband has found the wife complaining of severe back pain, for which no painkiller was given since admission. He's angry, he has the right to, and he wishes to speak to you. You are the senior house officer in the neuro to discuss the clinical situation, the management plan, and to address any concerns he may have. Assume that he has a permission from his wife to discuss the condition. For the time being, we'll give you a couple of minutes, Dr. Gamal, to prepare your paper, and we shall discuss how the paper should look like before getting to do your case. Exam-wise, you get 5 minutes. Still background echo, Dr. Gamal. If possible, the husband knows that she was not given painkiller because the wife told him that she has been having pain and there is no painkiller given. As easy as that. Okay, so you get 5 minutes beforehand. Make sure that you use them properly. Write down the name of the patients, the age of the patients, and your task. On top right, items of the history that I should never forget, whether it comes to station 2, 4, or 5, should include social history, past history, medication history, with or without family history, depending on the case in hand. All of those can be found in the PDF shared on Telegram. Quite easy, straightforward. In between, or approach for whatever station 4 scenario, it is gonna be a proper introduction at the very beginning, and those are 6 steps. A proper closure, and those are going to be 7 steps. In between, there is the stem, or what was the case is all about, or the case about. This is the general outline. You can find again the steps for all of those in the PDF shared on Telegram, and I will share the link again in a second. Before we proceed any further, let's agree on the basic principles. And as usual, the basic principle that I am not working as a doctor anymore. No, sir, I am not the senior house officer. I am not anyone except I am a doorman. By being a doorman, I always follow the guy who owns the building. He's an owner of the building. The building owner happens to be the consultant in the scenario, who happens to be an examiner when he has spare time. in order for me to be a good doorman, one, I always listen to what the building owner has said or mentioned regarding treatment or investigations, unless there is only one way of treating the condition in hand. Two, I should not give any time frames. Not today, not tomorrow, not whatsoever. Three, I should not give any promises because nobody knows what will happen in the future. And I should be avoiding direct answers, and most of the time, like yes, no, sex. I know, I understand. Those are ugly words. Please do not use them. Intimate relationship, you can only imagine. And whenever you're not sure, play the game of communication, and we will do that in a second. So back to the case, Dr. Gamal, if you are ready. Leo,
Yes, I'm ready.
Okay, did you write down your paper?
What's the name of the patient?
ده سؤال برضه يا راجل, not a question. He is Mr. and Mrs. Stewart. عملنا 20
تتغير
سنة.
ولا حاجه؟ انا بقالي كتير ما اعرفش.
يا معلم لا الراجل ده لاجئ معانا هنا محتلينه.
بيته مطرح يا باشا.
Okay, if you have written down your paper, the timer is on and the mic is used. Go.
Hello, Mrs. Stewart. I'm Dr. Mohammed Gamal, the senior house officer in the neurology department today. Nice to meet you.
Likewise.
Okay.
You're talking to the husband.
Okay. هو برضه Mr. Stewart صح؟
Yeah, last name. Couples share the last name.
Okay. Hello, Mr. Stewart. I'm Dr. Mohammed Gamal, the senior house officer in the department of the neurology today. Nice to meet you.
Likewise.
May I confirm that I'm talking to Mr. Stewart, the next of kin and the husband of Mrs. Stewart, 60 years old, female?
I am.
Okay, we are here today to discuss the condition of your wife. Is it all right?
Yes, please.
Would you like to someone other to join our meeting today?
No, thank you.
Okay, can you tell me what you know about the condition of your wife?
My wife has been very poorly over the past few weeks. Since she was diagnosed with this cancer that has spread to multiple parts of her body, she has been suffering a lot, losing a lot of weight, having lots of issues. But recently, she started to be out of herself. She started to lose consciousness, being confused at times, so I brought her to the hospital 2 days ago. And upon visiting her today, I found her mental state to be better. However, she's complaining of severe pain. And when I did ask in the ward, one of the nurses told me that there is no painkiller was prescribed to her since admission. And she's in agony. Why?
Okay, I appreciate all your concerns, and I will explain to you how the condition of your wife is going on. And before that, can I ask you what's your expectation from this meeting?
Well, I expect to know what happened, why nobody has been looking after my wife, why she's in pain, and who's responsible for this. I want to know everything about her condition, and I want to take her home.
Okay, I totally appreciate your feelings about your wife. Let me start by explaining the condition of your wife. Mr. Stewart, I'm so sorry to tell you that your wife has been diagnosed by having a cancer in her breast that has recently spread. I totally know that you know that, but I like to explain how condition is going in steps.
Okay.
Would you like to let me know about that?
Sure.
Okay, so your wife has been diagnosed with cancer in her breast that spread recently to various organs, including bone and brain and liver. She was admitted to our hospital by the altered mental state and was treated according to our local protocols. After we have found that there is a local cause, there is a cause for this, and we treat this appropriately with our team management plan. Then your wife was complaining of progressive back pain. Are you with me, Mr. Stewart?
I'm following you, yes.
Okay. We have consulted our medical team about that, and we are going to arrange for multidisciplinary team to discuss her condition. Back pain in the condition of your wife may be related to many factors. It may be related to a spread of cancer cells to the bone. It may be related to pressure on his pressure done by cancer cells that spread to bone that's compressed on her bone or her nerve cables, and it may be related to fragile bones because of her nutritional status that is not in the best state at time being. It may be related to
Doctor, I already know that my wife is dying and she has a terrible cancer. My question was, why no painkiller was given to her since admission? Why does she have to suffer?
Mr. Stewart, I appreciate your concern about that, and I totally understand her feelings.
Understand?
Yes, but
Are you sure
actually,
that you understand?
yes, Mr. Stewart, we are all here to help your wife.
Okay,
We will not let her suffer a lot.
you already did.
But we actually,
She has been
Mr.
suffering
Stewart,
with no painkiller for 2 days.
no, Mr. Stewart, we are not here to let your wife suffer. We are dealing with the difficult situation in your wife condition. I appreciate all what he are suffering for, but actually painkillers has many serious effects in her condition. She will receive painkillers of certain types, and certain other types cannot be given to her in her condition, as it may affect the other organs and may deteriorate her condition. Are you with me, Mr. Stewart?
Yes. So if she can receive some sort of painkiller, why she was not given any since admission?
Okay, I understand I appreciate your feelings about that, but actually it is the decision of our medical team, including the pain doctor and the cancer doctor, that decide the management plan for this. As I told you before, the types of medication that are given to your wife, it depends on the clinical situation of her condition till now, and it depends on the affection of the other organs in her body.
Okay.
Also, we need to know exactly what caused this progressive pain recently. So we need to run some investigation, including laboratory investigation and imaging, to know exactly what's behind this progressive bony aches or this progressive pain.
Okay, so do you want to tell me that part of assessment of her pain is to let her suffer for as long as she can tolerate, or for as long as it will take you to do investigations and find out the cause?
It depends. Some types of pain can be relieved if we know the
Jamal,
cause
I
exactly.
want you to take a deep breath in, think about it for 5 seconds and reply. The lady was not given any painkiller for a severe metastatic cancer pain 2 days. in the hospital?
Medical error.
What do you think?
Maybe medical error.
It's not maybe, it's definitely.
Okay.
Okay, so again, my wife has been admitted for 2 days. Let me make it even more clear for you. She has been receiving painkiller as part of her treatment at home for the cancer to relieve her symptoms. Since admission, she was not given any. Why?
Okay, Mr. Stewart, I am sorry to tell you that your wife hasn't received the medication because of a mistake has done in the delivery of medication appropriately to your wife. I'm so sorry to tell you about this mistake, and we are admitting this mistake, and we will make our best to know the problem for that. Meanwhile, we are going to start painkillers for your wife according to her appropriately to her clinical situation now. We also will write an incident report about this issue, and we will consider it to be discussed in our next meeting.
This is unacceptable. How do you want or do you expect me to trust you anymore? She has already been suffering. I want to take her home.
Mr. Stewart, I understand how you feel now about your wife and how you feel after this mistake. But let me explain that mistakes may happen in our medical field. But we are here to keep your wife in her best of medical condition as we can. We will give her full care and we will take care of all. We will give her all the care she will need.
Where is the consultant? I haven't seen him since he was admitted. Why didn't he come to see me?
Mr. Stewart, I appreciate your concern, but any decision for your wife is made by all medical team, including the consultant and the other medical personnel. As I told you before, we will inform the consultant and the other medical team staff about this error, and we will consult him for starting the painkiller for your wife as soon as possible.
Doctor, with all due respect, I think that you are not giving my wife enough attention. I'm not sure why, not because she's a VIP or a very rich person. I'm not sure why, but this is not the type of treatment that she should be getting.
Mr. Stewart, I am totally understand how you feel after this incident has been happened, but actually we are giving her all our best of care. We totally understand the condition, and our management plan is going on in the best interest of her condition now. Don't worry about the.
I have to worry.
I know you are worried about your wife condition, but make sure we are here to take care for her and to keep her under safe condition and to care about it and give her the best treatment.
Who's responsible for this error? I want to submit a complaint.
It is your right, Mr. Stewart, to submit a complaint, and I can help you by referring you to patient liaison and conditions, and who is responsible? As I said before, this is a decision for the medical team. The management plan is put by all the medical team, not one person. We are all responsible for the care for your patient. Is it clear for you, Mr. Stewart?
Thank you. But I want to take my
Mr.
wife.
Stewart, Mr. Stewart, I appreciate your concern, but let me explain that if you take your wife in this condition to home, it will aggravate her symptoms. Maybe it will be at life-threatening condition. So we need to keep your wife at the hospital to complete the medical care for her, as planned by our medical team.
No, with all due respect, that's enough. I want to take her home.
Can I ask you, Mr. Stewart, why do you want to take her home?
I believe that she will get a better treatment at home rather than this kind of treatment she's getting in the hospital. And this is my right to take her home.
Mr. Stewart, I appreciate that, but I think it's your right to take her home. If you, it's your right. It is the right of the patient to leave the hospital after signing a consent of leaving against medical advice. But as Mrs. Stewart is competent and in the complete medical capacity,
she's not competent. She has been confused over the past few days. She's not in a position to make that decision. I will take that decision on her behalf.
Mr. Stewart, I think she is now in a good medical condition and competent enough to decide this decision.
I know my wife better than you do, and I'm telling you that she has been confused. She only got better because she's suffering from the pain. She's just complaining of the pain, but she's not herself. She cannot take such a decision. I will take it.
Mr. Stewart, unfortunately, I cannot. This decision, Mr. Stewart, I'm sorry to tell you that this decision is belonging to your wife, as it's competent and can take this decision from medical point of view. So we will discuss her condition in another meeting with her, and if she decides to go home and to complete treatment
Doctor,
at
she's
home,
confused.
she will sign.
She doesn't have the capacity.
هي مش كانت اتحسنت ولا حضرتك بتقول لي ولا دي؟
I didn't say that she
ولا ده
improved.
patient ولا ده
I said that
الهازبند؟
she has been complaining of severe pain.
She improved. She's conscious.
Delirium or acute confusion equals intermittent attacks. It doesn't have to be chronic. It doesn't have to be persistent. Waxing and waning.
يعني هي lost capacity دلوقتي يا دكتور؟
The husband is telling you that she has lost her capacity since she has been confused and she's not in a proper position or situation to take the decision on herself. Okay, let's skip this part and we will get to that at the very end in the discussion. Carry on.
Okay. Mr. Stewart, can I ask you some private questions, please?
Sure.
Can you tell me about her medication list at home, please?
Let's skip this part, get to the closure.
Okay, Mr. Stewart, can I ask you if you have other concerns, please?
No, thank you.
Okay, Mr. Stewart, let me summarize what we have discussed today. We have discussed that your condition of your wife has been improved after treatment at hospital. She's complaining now of back pain, and ongoing investigation will be started, and appropriate analgesia or appropriate painkillers will be given as soon as possible. and to relieve her pain. Is it clear for you, Mr. Stewart?
Thank you.
Okay, Mr. Stewart. Also, I will give you some brochures and leaflets to help you to understand
Are
the
you sure?
condition of your wife, and مش فاهم.
Closure steps on the screen. You have done the first step, which is the concern. You did summarize to me. Next should be
So, do you have any other concern?
no.
Okay, can I ask you, Mr. Stewart, what are you getting from our meeting today?
That you have been giving my wife your best of care, and this is not enough, and I will submit a complaint.
Okay, Mr. Stewart, I appreciate your concern. And do you have any more concern, Mr. Stewart?
No.
Okay, Mr. Stewart, I will also give you some brochures and leaflets about the condition of your wife to understand more about it. And I will give you the contact number of our department if you have any more queries.
Thank you.
Do you want anyone to driving you home, Mr. Stewart?
No, thank you.
Okay, thank you, Mr. Stewart. Do you have any other concerns?
No, thank you.
Thank you.
Let's start the fight. So,
دكتور
overall,
محمد حضرتك tough قوي على فكرة.
no, it's not tough. It's simple concerns, and we have done those multiple times before. Just wait for it, and you will spill it out. حضرتك اللي هتقولهم من نفسك لمجرد انت هتشوف السؤال ان هو عدى عليك قبل كده بمنتهى السهوله. Let's go step by step, but overall you have done well, and expect the patient to be, or the surrogate to be, angry in the exam. I did not shout. I didn't make any drama. I was just strict in the way I'm asking questions, which you have been dodging. This is the main issue. You're not addressing my concerns. So, but beforehand, or before anything else, overall, you handled the pressure well, but still we need to get a little bit over some points, and you need to practice. You did not practice lately, did you? اعترف. Did you?
لا بعمل براكس فعلا بس انا بعمل براكس فعلا.
Okay.
بس حضرتك اللي شديد شويه.
Okay, يا باشا العفو. Let's go step by step. What is the medical issue in your scenario? Dr. Gamal,
Yes.
what is the medical issue in your scenario?
Back pain, delirium, metastatic cancer breast.
Medical issue, once we start with that, we always answer with the number, starting with the number. And the number here would be her age. She is, I'm simply asking you for the story, and the beginning of the story begins with her age. She is 60 years of age, Ms. Stewart, whom has been having blah, 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 blah. Do we agree?
Yes.
Agree. Next question. What are the ethical issues in your scenario?
Autonomy,
Which is?
malfeasance, right for the patient to know everything about her condition, beneficence to do the best for the patient, non-malfeasance to not to harm the patient, justice, equality of providing care for all patients.
Regardless of age, color, sex, and religion. Let's recap. Away from paragraphs, simple few words. Autonomy, this is the patient's right to know everything about his diagnosis, his management plan, and he has the right whether to accept it or refuse it. Beneficence is to do only good or what is in the best interest of the patients. Avoid malfeasance to avoid harming the patients. Justice, all the same, regardless. Do we agree so far?
Yes.
Agree. So let's go back to my concerns, because one of my concerns was why you did not give my wife the treatment that she deserves. Because she's not rich or famous? Does that relate to any of those? What do you think?
Beneficence. Non-malfeasance. No,
And
justice.
justice. So I was simply asking you for the definition of justice that you did not give me, although you know it. So I'm not tough. You already know it. Moving on. Then he said that I want to take her home now. And this would be considered part of his autonomy. He's refusing the treatment being given in the hospital. And we have steps for refusal. How many steps for any refusal?
Explain why. Explain the condition. بعد كده
How
why.
many? Four. One, you are right. Why? If there is something I can fix, I will fix it. Otherwise, I will move on to the next step, which is the benefits.
Yes.
Then
complication.
Then
consult.
Did you do those steps?
3 منهم. لا 4 والله قلتهم.
So you did ask me why. I told you I do not want any kind of treatment. The benefits that she's going to get the best treatment, and I disagreed. Then you told me that the complications may be potentially life-threatening, and I agreed, and I told you I will take the risk. Did you involve the consultant?
No.
So something is missing. This is the point. Again, you know everything about the case, but you did not implement it for one reason or the other. Let's move on back to the concerns. This is one of the concerns of both those not acceptable. How do you expect me to trust you anymore? Let's agree first on the principle. When will you consider someone or a case to be a medical error versus a complication? When would you consider a case to be an error?
If the team
fucked up. If the team forgot something, or something was not given properly, or in excess dose, or didn't
طب
check
انا اعرف
for
دي ازاي؟ هو مش المفروض في السيناريو يبقى لي ان دي ايرور؟
No, doesn't have to. Simply speaking, the lady, let's take a look at the scenario again. The lady is having metastatic breast cancer to the liver, bone, and brain, for which she was already on palliative treatments. She has severe back pain and no, ومعلم تحتها, and I underline it, proper analgesia were prescribed since admission. Is that an error or not? Did the team forget or the team overlooked the fact that she needs a painkiller or not?
ما توقعش يعني ما سسبكت ان في حاجه هي اللي منعتهم تديها ولا هو ما دام ما قالهاش في السيناريو ما فيش الكلام ده.
There is nothing in the scenario. The scenario is simply stating the fact that she was admitted for 2 days already on palliative treatment, and an essential part of the palliative treatment for terminally ill cancer patient is to receive painkillers. Since admission, she was not given any. Is that an error?
تمام. Yes.
So that's a medical error. And since this is an error, what are the steps that we do for any kind of error?
Medical errors. أول حاجة show empathy.
Okay. But I need points. How many points?
4 برضه.
5. قصف عشوائي. So we admit the mistake and we apologize for the mistake or the error. And it's a we, not an I. And we are insisting that this is definitely something unintentional. We never intended to do that. Mistakes do happen even in the best hands. We will write down an incident report and we will have an urgent meeting, including consultant in charge the risk management team to discuss what happens and to prevent it from happening again. And we will get over that with an apology. In every case of error, we start with an apology and end up with an apology. الكلام ده حضرتك عارفه من الأول ولا لأ؟
عارفه، بس هو ده medical error ولا medical negligence؟
What is the difference between negligence and error?
negligence فيها إهمال طبي، اللي هو we intended يعني intended medical error.
If the medical team does something intentionally to harm a patient, it would be a crime. So, for the sake of the exam, keep it simple. It is either an error or not.
مفيش negligence.
Negligence, some people say that this would be if something has happened or something went wrong, but there is no actual harm being opposed on the patients. But whom am I to tell if this is already harmed the patient or not? This is not my issue, this is not my territory, and it will differ from one examiner to the other. So keep it simple, keep it safe, play it safe. This is a biased exam. I would consider it either an error or not. Agree?
Agree.
So I want you to tell me about this error one more time under 1 minute. Can you do that?
Okay, Mr. Stewart, I'd like to admit I'm so sorry for what happened regarding the administration of painkiller to your wife. We admit I apologize for that, and be sure that it wasn't intended. I admit that what happened is something accepted, and but let me explain that the mistakes may happen even with best hands. Meanwhile, to write an incident report, consultant and the nurse team about that, and we will discuss this issue in urgent meeting with the morbidity and mortality team, and
please accept our apology.
We will refer this issue also to risk management team, and I'm so sorry again for this error.
So to recap this, Dr. Gamal, first of all, he will calm down, start to accept your speech once you admit it and you apologize. And in every error, we start with an apology and we end up with an apology. Unintentional, not to justify. However, mistakes do happen even in the best hands. And this is the answer to his question, how do you expect me to trust you anymore? We did a mistake, or we did a problem, or we did an error, but this doesn't mean that we are bad, because mistakes do happen even in the best hands. Incident reports is one of the legal issues. The urgent meeting is how that you're not going to let this happen again. Agree?
Agree.
Agree. So this is one more concern of the table. Where is the consultants? Who's responsible for this? I want to submit a complaint. Where is the consultants? What should be the ideal answer? Where is the consultant, Dr. Gamal?
الصوت قطع عندي.
Where is the consultant? Let's recap the rest of the concerns. The ideal answer should be? Are you there?
Okay.
So I apologize for what happened to your wife. The consultant, we are working here as a team. The consultant is busy with critically ill patients. If you wish, I can arrange a meeting with him as soon as I can. Make sense?
Okay.
Who's responsible for this? I want to submit a complaint. How many concerns are those? How many?
2.
2. That was invented in 1888. So the first one would be, who is responsible for that? And the answer is, we are really apologizing. We're sorry for what happened. Apologize for that. And this is, we are working as a team, and this is the responsibility, not the mistake, the responsibility of the whole team. I want to submit a complaint. Why do they bring up the topic of complaint in the exam, Dr. Gamal?
نبيل ده اللي في الشارع ده الفار
To the right.
في البلد ده ما علينا البيت اللي جوه في الشارع ده يعني. ده هيبقى لازق في دبكم ورا.
Okay, Dr. Gamal, why do they bring up the topic of complaints? Not for you to tell me that you're going to background echo again.
Too much background sound.
Yes, I know, my friend, and I'm trying to fix it. It's not from my side. Okay, so the complaint issue in the exam is not for you to mention only the patient advisory and liaison services. Instead, they are aiming for something else, which is justice. Again, we apologize for what have happened. Almost the same like the error. That was unintentional. We will do our best to correct it and provide your wife with the best care. If you still want to complain, I will direct you or will provide you with the list, or provide, I cannot focus. I can direct you to the patient advisory liaison services where you can submit your complaints. And please rest assured that your wife will get the best treatment regardless of your complaints.
Condition.
Complaints. You're not going to
Sorry.
discriminate her even if she complains or he submits a complaint. So this is why they bring up this topic in the exam. It's not for you to mention only the pulse or the patient advisory liaison services. Instead, also to add the principle of justice as part of the ethical issues. And finally, I want to take her home. Why? Because I do not want her to stay in the hospital. The benefits, she's getting the best treatments. The complications are potentially life-threatening. I will arrange a meeting with the consultant. I do not want to meet anyone. I will take her home. Let's put a proper approach for this case and we will get through that. So the first step was a proper introduction, or should be a proper introduction. And those are 6 steps. Breaking bad news, not really breaking bad news. Instead, here we are going to discuss the condition itself and to tell him about the error. Expect fury, expect anger, and expect multiple concerns. Then comes offering her something as treatment or management. But before we give, we always take. What is the most important part of the history here to be asked, Dr. Gamal?
Medical history or past history.
I agree with the social, I agree with the past, I agree with the medical. But in this case, terminal cancer with delirium, and the husband wants to take the wife home.
Social.
Advance directive and living well, lasting power of attorney. To recap, whenever something or some procedure or there is something that you need a consent for, the first one you're always checking for the autonomy is the patient himself. Agree? Do you agree?
Okay.
If the patient is incompetent for one reason or the other, the next step should be
Searching for advanced last power of attorney, advanced
directives,
directives, or living well.
Living well. If there is none, the next step should be.
Lasting power of attorney.
And if there is none, next of kin. What is the missing piece in your history? The patient is incompetent.
Ask about
You didn't ask me about
ليه
advanced directive.
incompetent بقى؟
Well, we should ask about it, and he will tell you no, there is none, and he is
why incompetent?
because the patient has been confused and there is no way at the moment to assess her condition. So you need to outline the management plan, meaning if the patient be assessed. If she's competent, she is the one who's going to take that decision. If she's not, we will refer to advanced directive or living will that she has already submitted. If there is none, then it will be the decision of the lasting power of attorney. But this is the way you should make it happen or tell the husband about it. This decision, first you need to check if you're suspecting that the wife is competent and he's saying no, she's not. Her competency will be assessed before the decision. A lot of background echo. Do we agree, Dr. Gamal?
Yes, doctor.
Okay. Okay, Dr. Gamal is having some. النونو زعلان مننا مش عارف ليه. Okay, if anyone wants to continue the discussion, I hate to go solo.
Yes, doctor.
Okay, دكتور جمال انا عارف حضرتك سمعنا، خليك معانا، ولكن خليني اكمل الدسكشن مع حد عشان let me continue the discussion with someone else because of the background echo for the time being, and whenever you feel like it, interrupt us at any moment. Anyone would like to continue the discussion with me? Anyone? No?
Yes, yes.
Okay. So I know this sounds. مين؟
Abu Bakr.
Dr. Abu Bakr, Habib. So, Dr. Abu Bakr, whenever we need to take a decision regarding any patient, the first one or the first point would be the patient himself. If the husband is telling that or saying that the wife is incompetent, what should be the response?
I will ask about advanced directive
And then, well, what if he says there is none?
there is none. The decision, I will go to the legal team.
So we will ask him if she did assign someone to take decisions on her behalf. Did she assign anyone as the lasting power of attorney?
Okay.
He will say, yes, she assigned me. I want to take her home. So I appreciate how worried you are, Mr. Stewart. This decision should be taken after fully assessing the capacity of your wife, which will be done by the MDT. Following that, the decision for her discharge will be taken after taking consultation or meeting with the hospital's legal team. So I did not say yes, I did not say no. I just outlined how things should go like from now on. Make sense?
Yes.
يعني
I agree.
هنا ما قلتش is the best
So-
interest of the patient you will be admitted in the
The best interest of the patient, since she's having confusion and she did not get proper treatment, to be admitted in the hospital till the team decides that she's fit to go or she can be discharged. But now he wants to take the wife regardless of whatever, just because he's angry.
معلش دكتور محمد معلش بس مش فاهم الحته دي.
Okay, so the team didn't or did not discharge the patient, right?
تمام.
So she's still getting good treatment in the hospital that she needs. So the team believes that the best interests of the patients is to stay in the hospital. Make sense?
Okay.
The husband refuses the best interests. So I am not going to argue with him. I am going to explore why, try to deal with the refusal. If not possible, I will tell him that this decision will be taken after legal consultation or taking a meeting or making a meeting happen between you and or taking advice from the hospital.
بعد ما كنت سالت على الحاجات اللي فوق اللي هو الادفانس دايركتيف والليفنج ويل واللاست باور اوف اتورني صح كده؟ يعني لو وصلت لمرحله النكس وبكان ساعتها هحتاج الليجل كونسلتيشن بعد الام دي تي صح؟
Yeah, because he will put you in that corner. He will just try to manipulate you. He will say that she's incompetent. She doesn't have any advance directive. and I am the lasting power of attorney, and I am the next of kin, and I want her out, which is against her best interests.
اوكي.
Agree?
بس هو مش في السيناريو، هو مش اللاست باور اوف اتورني. lasting power of attorney صح؟
You did not ask. I told you in the scenario, assume that he took a permission, but when you explore it more, he will be the lasting power of attorney. So, an introduction, followed by the error, history, and the most important part of the history here would be the advanced directive, living well, lasting power of attorney. Some examiners would consider this fatal to miss, especially in someone with metastatic terminal cancer. The management plan will be decided according to the conversation. And finally, we have the closure, and you have done it. So overall, it's not an easy case. It's not an impossible case. It's full of concerns. So the whole point is to always, Dr. Gamal, listen to the concern. Do not hear it. You had a plan, and when the plan didn't go the way you wanted, you started to go around avoiding concerns. So I'm saying the same thing in Arabic. يعني حضرتك كنت عامل حسابك على طريقه معينه يمشي بيها المحادثه، لقيتها اختلفت جوه ما ظبطتش قوي. But overall, all the concepts are clear for you.
اوكي دكتور محمد.
So it was a good one, and we definitely will be doing more. If you have any question yourself, go. If anyone has a question, go. Otherwise,
I have a question, please.
Yes, sir.
Yes, Dr. Muhammad, I have a question.
لو أنا بتكلم
Shoot.
I'm asking question. لو الهازبند عنده لاست باور باتورني تمام ونكست اوف كين وكل حاجه والبيشنت از انستيبل برضه حقه ياخدها البيت؟
No. If the patient has the lasting power of attorney or he is the next of kin and he is asking to do something or he wants to do something against the best interests of the patients, my answer should be dealing with a refusal, 4 steps. If still not convinced, tell him that you will arrange a meeting with the consultants before taking any decision. And this would be the end of the discussion with the surrogates. Then with the examiner, you would tell the examiner that no decision will be taken until you take an advice from the hospital's legal team.
تمام.
Okay. Any other question here?
Yes, sir, I have a question.
Shoot.
Sir, this regarding the confusion of the patient has confused me. When the patient is in confusion, does he have the capacity? And the second question is that about the scenario where the patient is confused and he has given the authority to son to talk to the surrogate, with the doctor.
Okay, that's a good question. Let's start with the first one. Confused. Part of having acute confusion to be reversible. So confusion can mean that the patient is going into a test when she is confused or she is confused back to baseline or not. Nothing important about it in the feedback that I got. Not sure about the exact scenario, but one way or the other, we will assume always that the patient has the capacity unless specified otherwise in the scenario.
Okay, thank you. This was the thing because the patient is confused and giving permission. The patient is confused and we are going to...
Yes, as long as it's not mentioned clearly in the scenario, she doesn't have the capacity. And the hospital was the one mentioning or bringing this up. And regarding complaint of pain, she doesn't have to complain even if she's confused. People with confusion still can say, I have a lot of pain.
Yes, sir. Yes. Thank you very much, sir.
Thank you, sir. Any other question?
Sorry. Regarding the concern, what you said that the husband was telling that you don't treat my wife as a VIP.
Yep. He's simply asking for the definition of justice.
So we'll just tell her.
For what happened. We admit our mistake and we apologize for that. Please accept our apology. Again, that was unintentional. And we please rest assured that we are treating all of our patients in the same manner or the same way, regardless of their age, color, sex, religion, or financial status. He's simply asking for the definition.
Okay. So
Okay.
we'll just tell him that we treat your wife, we don't discriminate her between other patients.
We
and
don't
we'll do our
discriminate.
best.
Yep. And since this is an error, I will start with an apology and I will end with an apology. In between, there would be the definition of justice.
Right. Can you repeat the steps of this one, sir, if it's okay for you? I mean, initially we will apologize, we'll be sorry, then we'll tell that it is unintentional. And
On the screen already, let's recap it. So
okay.
to recap those in 1 minute. And this is very practical exam-wise because of the time limitation. So we admit that this is a mistake and we are apologizing for that. Please accept our apology, not sorry. This was completely unintentional. Mistakes do happen, even in the best hands. You can add that we are a good team with high standards.
Professional team.
We will write down an instant report regarding what happened. We will have an urgent meeting, including the consultant in charge, the whole medical team, and the risk management team, in order to discuss how this happened and to never let something like this happen again. Again, we are sincerely apologizing for what has happened. Please accept our apology.
Thank you much.
Okay. Thank you, guys. I got to run now. It was a good one. Thank you, Dr. Gamal. Well done. Better yet to come. And I will see you tomorrow, inshallah. If you have cases for me, send it and we will discuss it. And see you tomorrow.